Hello, everyone, and it's an absolute pleasure to welcome you to today's webinar on a topic that is capturing global attention, which is HMPV. Is it yesterday's virus and today's challenge? Did you know that HMPV has emerged as one of the leading causes of respiratory infections globally? Despite being discovered just over 2 decades ago, this virus is now making headlines due to its increasing impact on vulnerable populations, including children and the elderly, and those with even compromised immune systems. Recent studies also indicate that HMPV accounts for an estimated 5 to 10% of global hospitalizations for acute respiratory illness, a statistics that underscores its growing significance in public health. But what exactly makes this virus a challenge today? Does it even make a challenge today? What sets it apart from other viruses like RSV or influenza? We are about to delve into these questions and even much more as we uncover the intricacies of HMPV and its implications for healthcare systems worldwide. Because to navigate us to help us navigate this critical topic, we are truly honored to have with us once again on one of the most distinguished and respected voices in public health and epidemiology, Dr. Amitav Banerjee. So welcome, doctor, and it's a pleasure to have you again today.
Thank you, Hetvi. Good afternoon. It's always a pleasure to come on MedSynapse platform.
So, doctor, let's dive straight into this fascinating topic. So, to start with, could you explain what HMPV is and how it compares to other respiratory viruses like RSV or influenza?
This is a respiratory viruses like many respiratory viruses. So it is
Mhm.
one of the also rans, I would say. It's not something spectacular. As I say about human beings, there are some people are born great, some acquire greatness, and some have greatness thrust upon them. So HMPV is in the last category. Neither it was born lethal, neither
Mhm.
it acquired lethality, but it had uh, sensation thrust upon it by the media because of the timing, I think. Because the world was just recovering from the aftershocks of the COVID pandemic, and anything coming out of China, the world got highly worried, apprehensive whether it is going to start another pandemic, the cycle, and China started reporting large number of respiratory infections. I mean, HMPV was just one of the viruses.
Mhm.
It is human metapneumovirus, and it is just identified as one of the incidental viruses. Besides other respiratory infections, also the China children particularly were having, and but there was not much details but for the some
Mhm.
pictures of overcrowded hospitals and overcrowd. There was not much say what we want in public health, ki how much is the lethality, how much is the case fatality rate, at least the start with the case fatality rate, what are the number admitted and number who succumb. That detail we never had to this day, ki what was the impact of HMPV on the survival or the lethality. So that means there was no lethality because no news is good news. Because and but of course the overwhelming of the hospital and the beds and other things, that actually this is the season, winter autumn for all respiratory illnesses. So HMPV, as you had rightly said, it was discovered almost 2 decades back in Netherlands, and that is the virus was identified, and that they went back also, and then they tested some stored serum in research labs. They keep the serum in cold storage. They found the antibodies
Mhm.
from 50 years back. So at least it is not only 2 decades back, it is 5 decades back. The I mean, that is as far
Mm.
as they could go. It may be maybe 100 years or 200 years or since. I mean, we are ecosystem. We are surrounded by many viruses, so it is just one of those garden variety viruses, and it is very
Mm.
ubiquitous. I mean, it is prevalent all environment and lot of among human carriers. It doesn't have any animal reservoir as such, though they have identified animal version of it, that is the avian metapneumovirus, AHMPV, but as on today it has no connection with the human virus. So probably it might have evolved like many species. Viruses also may have evolved from animal kingdom, but as on today there is no cross transmission or any such jumping of species or anything. So that is another worry which we had, and it is that way it is a very mild virus. It's RNA virus, and it has got four strains, A1, A2, B1, B2, and none of the strains predominate. All are on equal footing, and there may be some times different strain, repeated infections from different strain, but all the infections are self-limiting and mild. And being so prevalent in the environment, the children, as soon as they grow up a little, they start getting exposed to it. They start getting
Mm.
exposed to it. So they, from 6 months onwards, they start having the encounters with the virus, and then the immune system gets primed, and they, by the time they are 5 years old, by the time a child is 5 years old, uh, 90 to 100% of children have encountered the virus. So what happened? Why the sudden surge in China? That is the question. Why all of a sudden?
Mm.
This is explained. There are many reports. It is not only HMPV. Other respiratory infections have surged after the pandemic, and there are almost a dozen papers which indicate that this is due to the sort of a phenomena which has been coined, which is emerging, this term, the immune debt, immunity debt. That is the, or the immunity gap. That is the phenomena. How to explain it? It is explained like this: like as I said, the children when they grow up, first 6 months they are protected very with the mother's contact with the mother, and once they start crawling and playing with other children, they get exposed to. So this HMPV also 6 months the infection starts, and as I said, by 5 years, 90 to 100 get infected. But what happened during the pandemic, and particularly in countries which had very severe restrictions? The China was
Mm.
one which had restricted lockdowns and very severe. Similarly, Australia, New Zealand, and some other parts of Europe. So the children were insulated from the environment. They were not got infection they should have got at 6 months. They did not get it. What infection they should have got at 1 year, that batch also didn't get it. They grew up 1 year insulated from their surroundings, 2 years, 3 years. So over the past 5 years, different batches of children, cohorts of children born, they were not exposed to the virus, and this gave rise to a large number of vulnerable children who had never faced HMPV, which they should
Mm.
have faced earlier in a staggered manner. 6 months, 1 year. So children get infection not all at the same time, but according to the age strata. But here, what happened? The whole batch of last 5 years newborns, they were suddenly vulnerable and all got infected, perhaps simultaneously. That gave rise to a very large number of cases, 5 times more. I mean, this is one way of
Mm.
looking at it. And anyway, being a mild and self-limiting virus, it caused the panic, but it all got more or less everybody survived. And now, as per the latest reports, the cases are declining in China. So that is, I mean, everybody has been infected. They have developed a natural
Mm.
immunity, some sort of baseline herd immunity, which they should have. आई मीन जैसे 5 साल एग्जाम नहीं हुआ, आखिरी 5 साल में सब एग्जाम में बैठ गए, तो बहुत सारे कैंडिडेट्स आ गए. So it was a nature examination they all had to face, which they should have cleared by a semester system. They did not do the first because of the severe lockdown and strict restrictive measures and social distancing and too much of it. There is a concept coming which makes the children grow up vulnerable because the immune system doesn't get primed. Similar phenomena
Mm.
has been reported, published literature of immune debt. This is a debt we collect, the children collect. in their bank, the antibodies are not deposited as they would have been deposited by repeat infection. So they are going into a negative balance. So that is the immunity debt which they have to pay with the interest areas. Similar phenomena occurred in New Zealand. They had got, of course, other viruses, whatever the endemic viruses. Some countries they had higher rate of infectious mononuclear. Some got respiratory syncytial viruses, which became in large, surge in large numbers. New Zealand and in Australia also, because they also had very strict lockdown. Then in UK also they had the similar phenomena. They had a higher rate of, I think, meningococcal infections. Then in France also, and a large number of countries have reported this phenomena. So this is coming. This hypothesis is taking shape that whether there is a trade-off. If you are too much isolated, too much of say uh, social distancing, too much of say, I mean, as children in the natural, they playing, they play with dirt, they mix with other children, and now we are getting too much of that I would say that COVID appropriate behavior. Whether there is a downside to it, like whether we are losing the natural immunity and we have to just getting all this things which in the natural course or immune system has to also train like a child
Mm.
is trained with languages which a child is the natural immune system also trains with small doses throughout the staggered. So this is one way of looking at it, this phenomena, and fortunately there are no casualties. Some children are more vulnerable, those who are, I mean, I am worried about our country. We are vulnerable because we have got a very high rate of under 5 malnutrition. We have
Mm.
got a very high rate of under 5 malnutrition. And if you take the statistics, I mean, this has made headline. Even a large number of statistics also is a statistic. Individual cases
Yes.
make headlines. The one child in Gujarat tested positive HMPV and two child in Bangalore. It has got no actually, and that too 1 year 6 months old, which fits in the textbook picture because they start. But every day in India, if you see the statistics, 4 lakh children die annually from respiratory infections, under 5 children. 4 lakh, that comes to 1,000 children are dying daily from respiratory infections in India, daily,
Mm.
which may be including HMPV also. But so we
But
are losing children. It's not that because why? Because they are malnourishment. We are according to the latest survey, family health survey, national family health survey. About 37% of under five are stunted. About 7-8% are severely wasted, grade 3 malnutrition. So these children will have lower immunity. Similarly, the extremes of age, very old people with frail, with immunocompromised, with say anti-malignancy drugs, they are susceptible to any virus, including HMPV. So we are
mm.
already having this HMPV can be a wake-up call not to chase each and every virus as they are discovered because we have just discovered HMPV 2 decades back and that forgot about it. Now again it has come. So there may be hundreds of undiscovered viruses. So
Mm.
if you discover virus and start chasing that virus, it is just impossible. Firstly,
Mm.
secondly, better is like when you take the nature's way that the host resistance, the host immunity of the child as it primes, it takes care of multiple viruses. And we have to take care of the host factors because we cannot control that factor. So we can control the good nutrition. We have to eliminate child under 5 malnutrition on priority. That will protect
Mm.
against all high rates of respiratory deaths we are having. And even those children who survive a respiratory bout of infection, they again become more malnourished because the overall health
Mm.
suffers. So there is a vicious cycle of infection, malnutrition. Malnutrition gives rise to infection. Infection further aggravates the malnutrition. So 1,000 children we are losing daily due to respiratory infections, 1,000 due to diarrhea, diarrheal deaths. So we are
Mm.
neglecting on hygiene, sanitation, the basic, and we are neglecting on respiratory illnesses, and we are neglecting our public health infrastructure, which is very essential to prevent all these deaths. We don't have, as on the latest Comptroller and Auditor General report, it shows that
Mm.
across India, 50% vacancies are there in government hospitals and government health centers. 50% shortage of doctors. So the poor person doesn't have anywhere to go. The children
Hmm.
deaths could have been prevented. Respiratory infections can be deaths can be the viral is the just self-limiting. But some people, some children with lower immunity will have secondary bacterial infection. That that can be treated easily with antibiotics, and children deaths can be prevented. So it is a wake up. It's a something is not all right. HMPV is a wake up call. Though in India we may be having, as I said, in the remote areas, and but because of the panic, a lot of testing and other advertisements have come up. The labs are offering HMPV test, which has got no meaning actually. It's of academic interest. The tests are most costly, very costly, and the person who can afford that test would not be malnourished. So they won't have any vulnerability from HMPV. The poor children are really dying of malnutrition, and the government should not encourage testing because it will divert
Hmm.
resources from basic health care, primary health care, and the nutrition.
Yeah, I think that is rightly mentioned by you. There sometimes it is like that preventive measures should be taken just not for one virus, but for a lot of different things. So now, Doctor, can you tell us how does HMPV compare with more recent COVID-19 and even earlier swine flu epidemic?
It's interesting. I mean, this is COVID-19 behaved just in a different manner than HMPV. As I said, HMPV is affecting the children from 6 months to
Hmm.
5 years. COVID, on the other hand, spared the children. It did not infect the children at all. So the children were
Right.
not at risk, and that gave a wrong signal during COVID also. We closed the schools thinking like most of the viruses, the children are affected more, and the extremes are fate and children. So that was our teaching, and it was earlier viruses, including the HMPV, is affecting the children, though it is mild. But COVID never affected the children, and we overreacted thinking that children will be severely affected because there were some physiological reasons that ACE2 receptors were deficient in children where the COVID
Hmm.
virus attaches. So the children were the statistics, subsequent statistics also show the children had zero mortality from COVID. Very few were infected with some
Hmm.
comorbidities, malignancy or something, but by and large, it was almost negligible. So that way, that is one difference. COVID spared the children. HMPV infects the children. I wouldn't say it kills the children. It infects the children. COVID even perhaps did not infect the children also much, and even if infected, very mild. So that is one difference. And COVID, of course, I don't know whether because we are not having the exact statistic. HMPV is COVID was, I would call it mild on the children, mild on young people, and it
Hmm.
affected the elderly people with comorbidities. And it is similar, HMPV is also similar, and perhaps HMPV is still milder than COVID-19 also.
Hmm.
And it did
Hmm.
not cause, it's a very old virus. Since it is an old virus, uh, COVID is just a 4 5 year new virus, so more people will be vulnerable, and it has less time to mutate, and the
Hmm.
HMPV had more decades to mutate, and mutation, contrary
Was
to what
higher.
do not cause more severe disease, it causes milder disease because the
Hmm.
viruses keep adapting to the host. If it kills the
Correct.
host, the virus also finishes and it does not perpetuate. Only those strains survive which are milder. So since it's an old virus, so it is much milder, much milder. I mean, it's so
Hmm.
mild that it was not detected. I mean, वो क्लास में जो बच्चा हल्ला करता वही पकड़ा जाता टीचर के पास, जो बच्चा हल्ला नहीं करता वो पकड़ा नहीं जाता। तो ये 50 साल के पीछे जो है इट इज़ मोर देन, बट it 20 years बैक थोड़ा-सा कहीं हल्ला हुआ होगा तो किसी ने आइडेंटिफाई किया होगा, देन अगेन फॉरगॉट एंड नाउ
Yeah.
अगेन बिकॉज़ इट केम इन अ सर्ज, इट केम इन अ सर्ज,
Hmm.
तो वो इकट्ठे बहुत लड़के खड़े हो गए तो पकड़े गए। सो इट द वेरी फैक्ट दैट इट वाज़न्ट आइडेंटिफाइड, that shows
Hmm.
that it's a very mild virus because anything which creates symptoms which cause mortality gets identified. So
Yes.
that it is a very, I would say it is milder than the influenza viruses also.
Oh,
Uh,
yeah. I think that the surge and chaos was more than actually how much the impact is.
the timing, it matters on the timing and it matters on
Right.
China. Because as I said, this type of phenomena occurred in New Zealand before
Hmm.
China, almost 2 years back. This type of phenomena occurred in Australia. So there are papers on it. If you just, anybody can do Google search, just type immune debt
Hmm.
post pandemic. So all those papers will come up that many countries have surges of common childhood infections which never occurred earlier to the pandemic. And then they found that these
Hmm.
children who would have got these routine infections which are endemic in their country during childhood, they got delayed, and large number of
Hmm.
susceptibles, the population came up. So it is just one of those nature's way of coming back with a vengeance. You see, that also gives us some message that this respiratory infections, you just can't stay in a air bubble, or you can't stay in a vacuum.
Hmm.
You have to, you are connected with your environment. So you cannot prevent such infections which are ubiquitous, which are so, I mean, which are, you are surrounded by this. So you can,
Yes.
at the most, you can postpone it, not prevent it. You postponed it because of very strict measures of isolation,
Hmm.
quarantine, too much of hand washing, too much of, almost obsessive sanitizers. So you some sort of a hygiene hypothesis. I mean, this has come before the pandemic also, that with affluence, children are becoming more insulated from the environment, and their immune system is not getting trained, and so they are susceptible to hyperimmune reaction and autoimmune diseases whenever. I mean, since they are not immune system is
Hmm.
not trained. So this is again a hypothesis, not well established, but it had come in the textbooks also. This autoimmune diseases like bronchial asthma and other autoimmune disease, the incidence is going up with affluence. So we require more research on this, whether there is a, I mean, there are certain downside also of too much of, I am not saying
The
that you just keep rolling in
immune
the mud
system,
and don't wash
yes.
your hands, but you cannot overdo it beyond a
Hmm.
certain year. If you overdo it, there are certain downside also, because
Hmm.
and now very much it is coming that some of the microbes are beneficial to us. We carry thousands and billions of microbes on our skin, gut, respiratory systems. So they are, most of them are beneficial to us. So, and if you overdo it, so you are losing the protection by a
Protection.
ecosystem of microbes. You are disturbing the ecosystem. So these
Hmm.
are just broad ideas, nebulous ideas. It requires research, and or the question comes, where do we stop interfering too much with nature and assume unnatural measures of
Yes,
isolation?
actually. Because there's so many contradictory things
Yeah,
also. So sometimes it's like
it's a
you need
complex
to
thing.
take
It's a
prevention.
complex.
Yes.
We are getting too much of technology advancing and getting narrower and narrower, and too much
Mm,
of people are working in different cubicles, not knowing and not connecting the dots. So this
true.
all these dynamics are interrelated, and virology sees only one part of the problem, and then you are going for genomic surveillance, and you are going more and more, narrower and narrower, and
Mhm.
whereas the other things matter more. Your say own immunity, child immunity, the environment, the nutrition, and the racial differences also may be there. So many things are there. So we're
Right.
missing the big picture.
So, Doctor, you were also talking about it was first found in, it was actually before China, it was there in New Zealand also. So, I would like to know more about when was HMPV actually first identified, and are there any vaccines or antiviral treatments currently in development for it?
Yeah, it was identified in Netherlands, and I don't know why they identified it. We have to go back to it. I have my suspicions also about the hell they are doing. Like monkeypox was identified somewhere in Denmark, Copenhagen,
Yes.
and in a monkey which did not belong to, which Copenhagen, neither to Africa. It that monkey had a macaque monkey from Singapore. There is no monkeypox, and the monkey is not a natural host. And the research they were doing in
Mhm.
Denmark was on polio virus. So how did the monkeypox outbreak take place in the lab? So I have my question mark. Similarly, the
Mm.
Wuhan lab question mark. So many question marks are there. Then I don't know what these developed countries are doing because they are doing some gain of function research or something. So I have my doubts, and these are some things which we will never come to know because they will never admit it to what mischief they are up to. So,
Mm.
and of course, I did not say that in New Zealand and Australia the outbreaks were not necessarily due to HMPV. They were due to their endemic viruses. They had respiratory
Mm.
syncytial virus, and they may have not identified also. Firstly, secondly, they did not pay much attention to HMPV. Rightly so, because it is self-limiting. I mean, you can't run after every. Well, we are getting common cold with so many viruses. You don't do research on common cold virus. They tried doing it, they could not reach anywhere because the viruses keep changing, and there are thousands of many viruses, hundreds of viruses. Similarly, HMPV was an incidental discovery, and
Mm.
the interest was not there, and rightly so, because it wasn't causing any severe sequelae. It wasn't causing mortality also, and mortality was in highly compromised people, immune deficient people, due to other reasons, and those people in any case are vulnerable to so many things. So it was nothing specific about HMPV being a great year. So therefore, that's about it. Vaccine, there is no logic in making a vaccine for this,
Mm.
because how
Right.
much more milder can you make? I mean, nature itself has made it so mild that it is giving repeated doses from 6 months, and the child is developing natural immunity, and that too doesn't last long. Even
True.
the child gets reinfected again because because the virus is weak. So neither it causes disease, neither it causes strong immunity. So it is that weak. So
So
therefore,
yeah, which makes sense. Yes.
vaccine, you are supposed to make a vaccine which is weaker than the virus. Not the virus itself is weak. उससे भी अभी कमजोर साथी ढूंढने
Makes
में भी
no sense.
it is itself vaccine. मतलब I am talking about the theory behind this vaccine, and but the stupidity doesn't end there because they are making a animal
Oh.
animal studies are there to develop a vaccine for HMP. So I said that stupidity is there. They are developing it, but I, as a common sense, I think कि why you should make
Mm.
a vaccine because the virus itself is like a vaccine. इससे भी
Right.
माइल्ड अभी वैक्सीन बनाओगे तो
Mind.
एक्सीडेंट हो सकता है. The vaccine may turn out to be having more unknown side effects. You don't know the way
Oh.
things go. You are interfering with nature, firstly. Secondly, I
Mm.
think if the natural infection, the repeated infections are there, vaccine also won't be very long lasting. You have seen in COVID, the COVID vaccine efficacy goes down in 3 months, 6 months, you require booster.
Yes.
They took so much effort to make a, here they are making a vaccine, and it's a very mild infection. So perhaps the pharmaceutical industry may like to make a vaccine because then they wouldn't know whether vaccine is not working because the mortality is not there either way. So they will say, okay,
Right.
we have prevented you from the vaccine. So it won't be, I mean, you make a vaccine for smallpox. Well, smallpox used to kill 30%. So that is worth it. You make a
Mm.
vaccine for, say, even for measles, you make because measles is 400 times more severe in a malnourished child. And there are parts of the world where children are very malnourished, including India. So measles
Mm.
can kill a malnourished child, but if you have a very good nutrition, very good host. In future, you may not require a measles vaccine also because measles is mild in the healthy child. It is very severe in the malnourished child. So it is an interim measure. Vaccine cannot be a long-lasting solution because you will have newer and newer viruses. They are making. I mean, animal studies are there for HMPV, but another thing I am always worried is that a lot of these developed countries they are doing the gain of function research and making vaccines and all that. So, from mild virus, they may try to convert it into a severe virus by gain of function. So, usually, if left to nature, the mutation becomes milder and milder, benign and benign. But if
Mm.
tinkering with nature, they have already tinkered with bird flu also. Bird flu, they were doing gain of function research in 2012. They published paper. Then there was a lot hue and cry among the scientific community. Then they put a ban on gain of function research on bird flu. They did make bird flu gain of function in ferrets, different mammals. And strangely, in 2017, this was lifted. I don't know why. So gain of function research has been done on H5N1. and now we are having the threat of H5N1. Why the hell
Hmm.
you did gain of function research? So we can never be sure what the hell is happening, what these countries are doing
True.
silently.
Thank you for breaking that down, doctor. Now, let's just talk about diagnostics. Like, we know that it often plays a key role in managing infections. So, what are some challenges encountered in diagnosing HMPV?
It's nothing. The challenge is clinically, it is not very distinctive, any feature it has got. Like clinically, it's just like any, say, common cold virus. So running nose and all
Hmm.
that fever. So that is that can be a, say, a challenge in knowing it is HMPV, but you can say it is a
Differentiate.
viral infection and treat it as a viral infection. The challenge is
Hmm.
there. Secondly, if you want to know, the tests are very costly because the question is whether it is worth it. Because now the panel has come, labs are offering HMPV test commercial. Because earlier this test used to be done only in very specialized labs like National Institute of Virology or ICMR labs where there was a quality control. Now what happened after the COVID, any lab around in the corner is doing these tests. So that number of kits have come. So that the quality control is questionable. And then what you will do with the test? In fact, if my patient has HMPV, I will be very, very reassured. It is a minor thing. So it will not change your management. But
Hmm.
you see, the test came in the market because of the media. HMPV, everybody is with HMPV. Similarly, the vaccine also would have come or is coming, maybe the next hype of HMPV. But if left alone, this is very self-limiting. The test would be very costly, but if more people go for the test, it will become uh, less costly, but still
Hmm.
money. It's not money well spent on a test. If I
Yeah.
have to, as a public health person, I would not recommend the tests. I would recommend a test where the treatment course changes. There is no
Oh.
specific treatment for HMPV.
Hmm.
HMPV can cause severe disease and secondary bacterial infection that any virus can cause. So once the child develops pneumonia, difficult breathing, respiratory, I will treat it as a acute respiratory infections with antibiotics because that is the secondary infection. So there is no specific test for. There is a specific test, but it is not worth it.
Hmm. Yes, rightly mentioned. I think if there, it is not creating so much of havoc and it can be treated well without the test, so why
Yes.
not? Why
Yeah,
taking a
exactly, exactly. In fact, the general practitioners used to treat all these things without panic. So
test?
now it is. You see, people rush to hospital because of
Hmm.
HMPV, and they may get some other infection in the hospital. You know,
Correct.
hospital infection is one of the major causes of morbidity mortality. The child will come with one HMPV infection, admitted to hospital, it will get 10 other viruses, other bacterial.
Hmm.
That
Definitely.
people do not
Yes.
realize. I mean, that's why the
Yes.
avoiding panic is very important in this type of
Hmm.
situation. And just see the child breathing should be there, child should be feeding, child should have good appetite. Some runny nose and all that, it clears in within a week. So it should be
Yes.
treated that way. I mean, no test is required. Now, tomorrow, for many common cold viruses will be discovered. You will be testing whole thing and getting unnecessary panic. So
Right.
some
So
should
I
be let
think more
alone.
panic is created than actually how important it is.
Yeah, yeah, yes, yes.
So, Doctor, are there any specific public health strategies that can help reduce the spread of HMPV?
As I said, this early care, I mean, HMPV, as I keep saying, is a wake up call that we should be alert.
Hmm.
HMPV is just a wake up call without causing any. It has brought to attention that
Right.
children are dying of respiratory illnesses, irrespective of HMPV. And for that, as I said, we should have a good primary healthcare system where secondary healthcare system, and if the doctor is not there, the primary health center, if the village level, block level, they will crowd to the urban hospitals and they will get other infections, cross infections, and they will give infections also. So you are spreading many infections. HMPV is a mild year, So that is
Hmm.
important, and same thing happened. And then if you go even any day, you go to any government hospital or government medical college in India, you will find crowds, perhaps more crowded OPDs than the China photos. It is because there is lack of proper health services at the primary level, secondary level. So all nearby villages they come crowd. So
Right.
we, as I said, just for HMPV, you may call it HMPV or you may call all respiratory illnesses. You should have a spread out health facilities where the primary care physician should be able to treat a common cold or HMPV. You don't require a
Hmm.
specialist to treat HMPV. You do not require a specialized lab and investigations. It is not going to change your treatment. It is just care of the child, good nutrition, good hydration, which a general physician can advise, even a nurse can advise. Hydrating the child, good nutrition, and early signs of any respiratory distress. The child is having, breathing problem, respiratory rate goes up, then you evacuate to the hospital, not by just a sneeze or a cough or a lab test. The false
Yes.
positive and false negative is also very high with these type of tests which are coming
Hmm.
up.
Yes, I think that is so rightly mentioned also that we need to look out for simple preventions as well rather than just creating chaos
Yeah.
and panic. So that on that note, how well is HMPV monitored globally, and are there any gaps in current surveillance systems according to you?
They are not monitoring it. No. I mean, they are not monitoring it because rather than monitoring HMPV, they should monitor the influenza-like illnesses and then see if
Right.
there is any change in severity or any change. Then only they will monitor that specific virus. HMPV has not shown any signs of being severe, so it will be wasting resources. You see, as a public health measure, you have to prioritize which things to monitor. I would rather monitor dengue because dengue causes more deaths than HMPV. I would like to monitor other tuberculosis, where 1400 Indians die of tuberculosis daily. So I would even like to monitor typhoid because there the deaths are more. We are still
Hmm.
having. But HMPV is very self-limiting. Monitoring is not one virus specific. Monitoring is influenza-like illnesses. That already takes is there, and
Yes.
that's how probably they must have identified that China may there is a surge because though that is a regular public health exercise, but they don't identify that HMPV. They identify as any surge in respiratory illnesses, and from that
Hmm.
respiratory peak, they might have identified HMPV because they must have tested
Hmm.
some. And but that phenomena can and it occurred only in children up to 5 years, so that could be explained by that since these children did not get exposed to the environment last 5 years. So and there have been no reports of any casualties from China also. So if they know, so that means that's about it. I mean, you see, if you take, as I said, in India also, all children, by the time they are 5 years old, 90 to 100% children have encountered HMPV. That means 100% of a population, you and I have also got HMPV in our life many times. So that
Oh.
way, why you have to monitor something when you know everybody has been affected by it?
Hmm.
Something as
Right.
common as the air we breathe and the water we
Hmm.
drink, HMPV we have been getting because when child is 5 years, it has experienced 100% children have encountered on normal times the HMPV virus. So what is the point in monitoring that you are going to get it in any case? So what will you do with monitoring it? I mean, it doesn't make sense.
Yeah, so it is already very common. So what to do
Well,
with monitoring? That makes sense. Yes. So
it's
now,
a part
doctor.
of
Yes. So after COVID-19 pandemic, how prepared are we to face an epidemic also like HMPV?
we were not prepared before also, we are not prepared today also. We will just go around making this exercises because as long as our primary health care, as long as your public hospitals are undermanned, as on today, according to the
Mm.
Comptroller Auditor General report, 50% vacancies in government hospitals and primary health centers are lying vacant. 75% vacancies of TB specialists are lying vacant, and TB is a pandemic we are having 1,400 deaths every day. So we are not coping with the pandemic, which are silent pandemics going on. TB pandemic is going on daily. We lose 1,400 patients from TB where the treatment is there, because 75% in Maharashtra, 75% vacancies are there which are unfilled. TB specialists.
Mm.
So we are not prepared. I mean, you cannot say like we were as unprepared as we were when we went to 1962 war with China. With soldiers were unprepared, we lost badly. So we are not prepared, and we require to do the homework, which has been neglected by successive governments since independence. So, and no
Mhm.
government will do it because it is a very unglamorous task. It is very cost intensive. Health budget is just a band-aid because the basic primary health care, we don't have hospitals at the rural areas, which the board committee has advocated. No government will do it because those things will not get attention, unglamorous. Nothing will happen. People will get cured. There won't be pandemic, so the government will not come in light. So, and each government will blame the previous government, and all
Correct.
governments are equally party to it because we have not developed a private health infrastructure since independence, and now it is going the other way. We are going for public-private partnership with more of corporatization, where the profit motive comes, and unnecessary testing, unnecessary hospitalization, unnecessary. So that is why we are and in fact, they like to have pandemics because then the profit motives goes up. So, but the genuine pandemics are neglected, or child deaths, respiratory
Mhm.
deaths every day. 1,000 children are dying from diarrhea, from respiratory illnesses, tuberculosis. People are dying. So these pandemics, we are not. We are having pandemics. I mean, how we say ki next pandemic? We are having pandemics in our country. So and which require
Yes.
government.
Yes, I think that is so rightly mentioned, and I think these strategies are really important for government also to look out for. Now, Doctor, we have certain questions from the audience. Let's take those up. So, first up, we have that. In your opinion, what are the most critical infection control measures to prevent HMPV transmissions in hospitals, especially in high risk units like ICUs?
They already have in place, that is enough. They have got infection control practices, whatever the normal ventilation, they have got pressure ventilation, then limit the number of visitors, limit the number of hospital visits, people crowding, and that's about all. And going
Mhm.
too much out of the way, as I said, we are surrounded by HMPV all around. We have been getting it number of times. Now we know Shakespeare was wrong when he said, "What's in a name?" Now this virus has got a name. Everybody is worried about the panic. So without the name, nobody was worried about infections and common cold. But now, since we have getting a name, there is no any extra measure required. And particularly for HMPV, which is a very routine precautions, routine hand washing is good enough, and that's about all. Not all.
Mhm.
Obsessive hand washing also not required. Most of us will become, obsessive compulsive disorder type. So routine hand washing and too much, as I said it, थोड़ा-थोड़ा डोज से इम्यूनिटी अच्छा रहता है। बिल्कुल साफ करने से अगेन
Hmm.
children will become more vulnerable. I am not saying कि put them in dirt, but routine what we are practicing, normal hand washing and normal cleanliness, that is enough.
Yes, correct. Now, Doctor, what are the current epidemiological trends of HMPV globally, and how do they vary across different regions and populations? Is one more audience questions that we
Yeah,
have.
whether we will have more, we are China and India, we have got a very large child. So basically, it's a childhood infection because it's any virus which is highly prevalent will affect the children first. COVID was an exception because of some physiological reasons, and by and large, children and the vulnerability also is more in children who are malnourished, who have got pneumonia, and the elderly. But other healthy population, adult population, they will be carrying on their normal duties without getting affected. So there is nothing very specific about this. Just like any virus infection, it is behaving.
Mhm.
So and it is not causing
Yes.
any sickness, absenteeism also, or anything. So that's like a normal flu, a normal, I mean, one of the garden variety of viruses. Even among flu viruses, it would be lower on the pecking order. So
Hmm.
not much. You take care of the major respiratory illnesses, this will take care of itself.
Right. So now, doctor, one more question is: what is the impact of seasonal changes on the incidence of HMPV infections, if there are any, and how can we actually better predict outbreaks as well?
Yeah, that is right. That's a good question. Seasonal is in the winter and spring because the winter the
Hmm.
your atmosphere is dry, humidity is less, so the respiratory passages become very dry. Mucus is not there, so they get abraded and they are more vulnerable to infection in the winter season and the spring
Hmm.
season. So seasonally in winter, like all respiratory illnesses, again nothing specific. So that is the seasonal variation.
Right.
And for that,
Thank
you
you for.
require hydration, you require some steam inhalation if you have got any respiratory infection. Steam
Hmm.
inhalation,
Hmm.
lot of fluids, lot of water, well ventilated rooms. So that's about all.
Hmm. So basic precautions can also be taken, I think.
Yeah, the good
Um,
ventilation. Take sunshine. Be in the sun in
hmm.
winter because vitamin D also is associated with lot of viral infections. Lowered vitamin D, and many of people are having very low vitamin D levels. If you do any survey, it's almost 70-80% vitamin D deficiency you will find. So people do not go out in the sun nowadays. They are afraid. So the sunshine, or you may require vitamin D supplementation also if you are deficient in vitamin D. And fresh fruits and vegetables because vitamin C is also important. And fresh fruits and vegetables, good diet, balanced diet, sleep.
One last question from the audience is, Doctor, what are the key risk factors associated with HMPV transmission in community and healthcare settings?
Community, we have got a problem of housing and other things.
Hmm.
Overcrowded houses, particularly in tenements, slums, and similarly, healthcare settings. We are overcrowded, particularly in public because of the shortage of facilities and doctors. They are overcrowded. The public health facilities are overcrowded. So wherever there is overcrowding, there will be more transmission of all respiratory viruses, including HMPV. In fact, I am worried about other respiratory transmission. HMPV, as I said, is just a marker.
Yes.
HMPV, I am not as worried about HMPV, but anyway, people are worried about it. So I want to reassure them. You don't worry about HMPV. You just take care of your good ventilation and good housing. And perhaps the people staying in overcrowded houses, children, they become develop resistance faster also. So that is it is the well-to-do who are now isolated and they are protected too much, I would say. So that fragility of the immune system steps in. So they are vulnerable to repeated
Yes.
infection.
Correctly mentioned by you, Doctor. So that's such a powerful way to actually conclude our discussion today, Doctor. And your actually perspective reminds of us of a lot of different various things that healthcare needs to take care of also. So thank you so much for sharing your insights today with us.
Thank you. It was a pleasure interacting with MedSynapse. Thank you so much. Thank you. Good day.
And it's an honor to have you, and I'm certain that our audience has gained a wealth of knowledge from your experience today, Doctor. So thank you for joining us.
Thank you. Thank you. Good day.
And to our audience, stay tuned for updates on the future webinars. And until next time, stay safe and take care. Thank you so much, everybody.